So international courts may not be up to the task. But the world cannot look the other way as China and its accomplices break the rules. Accomplices like the World Health Organization, a body that has been parroting China's lines since the beginning. The WHO is made up of member states, 194 of them. The challenges it faces are institutional. The WHO is only as effective as the nations that make up this body. So cutting funds and issuing threats won't really work in the long term. Someone will have to get their hands dirty and fix the flaws in the system. Could that someone be India? There's a good chance. Starting the 22nd of May, on this day, India will take a leadership role at the World Health Organization. New Delhi's nominee is expected to be appointed the chairperson of the WHO's executive board. What is the executive board? It's a WHO wing. It is responsible for executing decisions, for implementing policies of the Health Assembly. India's nomination was unanimously upheld by the WHO's Southeast Asia group last year. India will be replacing Japan. Japan completes its one-year term. India is expected to hold the post for at least 3 years. This implies that the Director General of the WHO, a certain Dr. Tedros, who promised to give us an interview but hasn't since, will have to get the chairperson, Dr. Tedros will have to get the chairperson, India, on board for all important decisions. So tonight we have 5 suggestions for the Indian government, 5 things that India can and must do to fix the broken system of this health body. A good place to start is to ask questions. Push for accountability from WHO leadership. Questions like, why did it buy China's word on human transmission? Did it downplay or blatantly lie about how lethal this virus was? Did it declare a pandemic? Why did it declare a pandemic only after the virus had reached 85-odd countries? Dr. Tedros sent a WHO delegation to China. What again did it achieve? And why can't the world talk about the place of origin of this virus? India must begin by asking these questions without hesitation. Second, demand transparency from member countries, starting with the one that gave the world this virus, China. Why and on what basis should we trust China's recovery? Why won't it share research and initial test samples with WHO member nations? What evidence does China have to claim that this virus did not originate in a lab in Wuhan? Why shouldn't global experts have access to this lab? And most importantly, the wet markets, are they back? And if they are, what are they selling? Under what conditions? And what assurance can China give the world that another disease is not waiting to explode there? 3, India must insist on financial independence. Financial independence of the World Health Organization. How much does money talk at this body? Let me rephrase that. How much does the yuan talk at this body? Because why is it that the WHO chief is singing praises of a regime that facilitated this pandemic? Reports say that contribution by countries in lieu of their membership fees to the WHO is extremely low. So this body's budget is mostly financed by voluntary contributions, donations and grants that come from public and private sources. How much does the WHO depend on these extra budgetary resources, as they call it? Which private sources are sending money to the WHO? Are they from China? And if yes, how much influence do they wield? The world must know. 4th, India must push for Taiwan's inclusion at the World Health Organization. The WHO labels parts of India as Chinese territory. On their map, the WHO map, parts of India are shown as Chinese territory. But when it comes to Taiwan, this body adheres to the One China principle. Forget praising Taiwan's success story, it doesn't even acknowledge its existence. India must rally support for Taiwan's observer status at the World Health Organization. Taiwan must be permitted to share its expertise on the pandemic for the simple reason that its response has been the best. And lastly, conduct an independent international probe on the outbreak. Breaking news. China says it is ready for an international probe. And now the caveat. China wants this probe in quote-unquote close cooperation with the World Health Organization, a body that it already controls. And this is the point that we've been trying to make here. Why should China dictate terms? How is a probe independent and transparent if it is dictated by the alleged perpetrator of a crime? Also, will China allow access to whistleblowers, to doctors in Wuhan who disappeared, to citizen journalists who have been re-educated? Will it let investigators visit the laboratories and wet markets in Wuhan? India must push for a transparent probe into this outbreak, and the world must not waste time mourning missed chances. We have wasted enough time being politically correct here. We finally have an opportunity. India must take the lead, and WHO member nations must extend their support.